More than 50% of child mortality in low and middle income countries have been attributed to lack of effective pre-hospital care and emergency care systems. So therefore, in 2017, the National Health Mission, Tamil Nadu, established the PREM initiative in 28 district headquarters hospital. PREM is an acronym for Pediatric Resuscitation and Emergency Medicine. PREM also means love in all Indian languages. So this video will describe how to set up a PREM unit in hospital with limited resources. The location. Identify space at the entrance of the hospital inside of the General Emergency Department or near the outpatient department on the ground floor. Display the PREM logo at the entrance. This will inform parents of the institution's preparedness for managing acutely ill children or pediatric emergencies. Infrastructure. Ensure at least one wall-mounted suction and oxygen from central source is available at the head end of the resuscitation trolley. Large volumes of oxygen is needed throughout resuscitation, and this cannot be provided by cylinders. Provide electrical points, minimum 8 plug points, 5 and 15 amps, 3 feet above the ground on either side of the resuscitation trolley. Virtually all instruments or equipment used for resuscitation are electrical. Suction apparatus, monitors, infusion pumps. These require adequate availability of plug points, and these have to be placed 3 feet above the ground. Make sure that a multi-channel monitor is mounted at the head end of every resuscitation trolley. If unavailable, a pulse oximeter will suffice. How do you organize the resuscitation trolley? Place the resuscitation trolley perpendicular to the wall. All sides of the trolley should provide access to the patient. The height should ideally permit performance of procedures, airway management and clinical assessment.
No grunt, intermittent strider plus.
Wheels must have functional brakes to prevent movement of the trolley during CPR. Cots or beds are not ideal for resuscitation. The headboards and the side railings prevent access of the child during emergency procedures. Place a chair alongside the resuscitation trolley. Unless unresponsive, resuscitation can be comfortably performed when the child is placed on his or her mother's lap. If the child deteriorates, rapidly the child can be shifted from the chair to the resuscitation trolley, and if the child gets better, can be shifted back to the caregiver's lap on the chair, which is positioned near the trolley. Place the airway stool at the head end of the trolley, ready to use by the airway manager or team leader. Arrange an adult bag valve mask with reservoir at the head end for ready to use purpose. Stock various sizes of masks close at hand on the table top of the crash cart. Organize an electrical suction apparatus on the left-hand side of the airway stool. Ensure that a Yankover suction tip is attached to the apparatus. It should be covered and ready for use. Place a standing BP apparatus on the right side of the airway manager. Stock pediatric and infant BP cuffs. The Jackson recircuit should be available close at hand. Prepare a 500 ml normal saline bottle with an IV set ready to use. Place the pre-formatted PREM case record at the foot end of every resuscitation trolley. Allocate at least 4 syringe pumps for each trolley. Critically unwell children require a lot of infusions. They may require inotropes, vasopressors, maintenance fluids, anticonvulsants, for which infusion pumps are required. After the neonatal period, the first 3 months of an infant's life are the most vulnerable. Part of the PREM preparedness includes availability of a warmer inside the PREM unit. Place the warmer perpendicular to the wall, close to the wall suction and oxygen outlet. Ensure sufficient electrical points. Additional points are needed for the warmer and its light source. Organize an electrical and central suction with a Yankover suction tip. Organize a standing BP apparatus with infant cups. Organize infusion pumps and monitor for every warmer. Organization of the crash cart. Place the crash cart accessible to the resuscitation trolley. Organize and label drugs, consumables and procedure trays. On the top shelf, place IV fluids like normal saline, Ringer's lactate, dextran, glucose normal saline. In the drug compartments, In the first row, hydrocortisone, dexamethasone, chlorpheniramine maleate, aminophylline. Second row, midazolam, levetiracetam, phenobarbital, sodium valproate, 25% dextrose, 3% saline. Third row, pre-filled adrenaline, noradrenaline, dopamine, and dobutamine ampules. On the tabletop, the mask tray with the various masks, IV access tray with a glucometer. The drawers, top left, laryngoscopes of various sizes, batteries, bulbs, shoulder pads, trouser cut plasters. Top right, age-appropriate nasogastric tubes. Middle left, various sizes of the endotracheal tubes from 2.5 to 5. Middle right, Venflons, 24 gauge, 22 gauge, and 20 gauge. Syringes of various sizes. Bottom left, suction catheters, gloves, etc. Bottom right, IV sets, infusion sets, 3-way stopcock. At the bottom shelf of the crash cart, the Jackson ray circuit, intraosseous tray, nebulization tray, catheterization tray, intercostal drainage tray, etc. can be stocked. Use a crash cart for storing non-refrigerated drugs. Labeling must be legible. A 1 in 10,000 adrenal vial should be prepared and available. Note the date and time of preparation. Prepare sterilized procedure trays. Replenish the cart prior to every shift. Instruct nurses to check and hand over the crash cart at each change of shift. Ensure availability of a length-based dosing guide, Broslow's tape or power tape. These tapes help to estimate weight based on the length of the child. It is indispensable for calculating the correct dose of drugs for children and also choosing the right sized consumables. Stock and use a pre-calculated weight-based resource, Pediatric Emergency Medication Book India, for urgent medications. This reduces the risk of dosing errors during resuscitation. Store linen consumables such as gauze, diapers, clean towels, etc. in transparent containers. Maintain organization of all equipment inside the PREM unit using the 5S Kaizen principle, that is, sort, set in order, shine, standardize, and sustain. PREM protocols. Display and employ PREM protocols. Use the PREM triage form in the outpatient department and the PREM case record for documenting during active resuscitation. Organize biomedical waste and sharps disposal as per national protocols. The defibrillator can be located in the adult ED and shifted if needed into the PREM unit in smaller hospitals. In summary, by implementing PREM protocols and providing life-saving equipment as per PREM SOP in rural and secondary care hospitals, the Tamil Nadu state is actively lowering infant mortality and under 5 mortality in the state.